If you're suffering with diabetes, or even if you just want to randomly check your blood sugar levels, then the one test that will be suggested to you is the HbA1c test. In this video, let us know what is HbA1c and also understand whether this test is really reliable in confirming the diagnosis of diabetes mellitus. HbA1c is also called as glycated hemoglobin or glycosylated hemoglobin, and it is present in the red blood cells of the circulation, and it is responsible for giving the red color to those cells. This HbA1c test, which is done for diabetic patients, calculates the amount of glucose which attaches itself to the hemoglobin part of the RBC cell. Normally, after you have a meal, through the process of digestion and metabolism, everything that you have eaten is broken down into one simple sugar, that is glucose. Then this glucose is delivered to every single cell of your body, where it is converted into energy and different functions of the body take place. In a healthy individual, the sugar levels is kept in its normal range by a hormone called as insulin, which is produced by the pancreas. If a person is not able to produce sufficient amounts of insulin, or the body fails to use up the insulin which is produced, then the person ends up in diabetes. Now, in such diabetic patients, the glucose levels remain increased in the body and it gets attached to the hemoglobin part of the RBCs. Such a hemoglobin is now called as glycosylated hemoglobin, glycated hemoglobin, or simply HbA1c. Now, how does the HbA1c test give you an average value of the glucose level for the past 3 months? There are two types of blood tests to detect blood sugar levels. In the first category, you have fasting or FBS and postprandial, that is PPBS, which means checking your blood sugar levels 2 hours after eating. So both of these gives you the blood sugar level of that day. The second type of test is of course this HbA1c test, and this gives you an average value of the blood sugar level status for the past 3 months. So how is it possible to give this average value? See, RBCs in our value have their own lifespan, meaning once they are formed in the body, they remain in circulation for about 120 days. And at the end of this 120 days, it is broken down or destroyed in the spleen. So that is why when you do a blood test on a patient, it gives you an average value of all the RBCs in that particular 120 days or 3 months time. Now coming to the part of whether this test is reliable in confirming diabetes. Though this has become a kind of go-to test to detect diabetes and also a routine test in diabetic individuals, a question of whether it is reliable always arises. And this is because HbA1c levels increases not just in diabetes. Yes, though HbA1c is used as an indicator to detect diabetes, in reality it simply shows that glucose is attached to the hemoglobin. And there are various other conditions which also causes glucose to attach itself to the hemoglobin. To list a few of these conditions, you have iron deficiency anemia, vitamin B12 deficiency, alcohol consumption, smoking, multivitamin supplements which you may take, certain medicines, especially blood thinners like aspirin, certain viral infections, sleep disturbances, kidney diseases, long-standing gastritis, and many more. In all these conditions, HbA1c levels will be raised. So if you find that your HbA1c levels are raised, then before coming to a conclusion that you have diabetes, please do get a fasting and postprandial blood sugar levels checked. If these tests are normal and only HbA1c is increased, then do consult your physician to determine the other possible causes as mentioned earlier. So in short, HbA1c definitely shows you a raised value in case of diabetes mellitus, but please remember that it is not a reliable diagnostic tool to confirm that it is a case of diabetes. If you found this video helpful, then please share it among your friends and family and subscribe to this channel for more such informative content. Stay healthy. Thank you.